It is Thursday, and that means it is time for Mornings with the Mayor with our friend, Mayor Gina Ortiz Jones.
That's right. Once again, San Antonio Mayor is here joining us this morning for the first of many mornings with us to discuss key issues with our city. Good morning, Mayor.
Morning.
How are you this morning?
Great. How are you all?
Great. You just wrapped up the budget. Now, the police budget was about $630 million. That's over $27 million more than last year. 65 officers were added. How do you think that will translate to possibly safer streets for our city?
Yeah, so we had this conversation in our budget process, which is how do we have a more holistic understanding of public safety? So whether you're talking about some of the investments in public health that in fact allow kids to be in school more, which means they are not doing things that are unproductive in the streets, right? And this is important because public safety came in each of the budget town halls that I went to, and of the 11, I went to 6. And public safety comes up, but it looks different in each of the areas. District 5, for example, when I was there was a young man saying, hey, if you care about public safety in District 5, make sure you fund our Parks and Recs program for our young kids so they've got something good to do.
District 5 is what part of town?
Downtown.
Okay.
Yep, downtown, west side,
Okay.
right? And so I think it's really important that when we're thinking about law enforcement, we're thinking about public safety, there's a number of things that contribute to that. Mental health in particular, preventive measures as well. So I think moving forward, we've got a good chair and chair core. The 2 subcommittees I also asked her to set up as it relates to public safety is one, elder abuse. We see that a lot, unfortunately, and especially on the financial side, as well as interpersonal violence. And this is important. We have, unfortunately, one of the highest rates of domestic violence in the entire state. And we know in financial times, you actually see more domestic violence as folks are just not able to grapple with the economy, which is obviously top of mind for us.
We were talking earlier before we came on about just the amount of money that you have to spread, the pie that you have to cut up. Obviously, you get to fund some things didn't get funded. They didn't make the cut, so to speak. What were those things in your mind that maybe we should be focused on, and as you look forward to 2027, 2026 and 27?
Yeah, 27 in particular. Thanks for raising that. You heard a lot from me during the budget season about, look, 26 is not, there's a little bit of a deficit, but the real deficit that we've got is in 27, right? 27, we have a $150 million gap in our budget, and if we don't take some significant steps, that budget gap will grow to $220 million in 2030. So it's really important, in particular, one of the areas I'm most concerned about, because we are going to see the impacts of federal cuts. It's not an if, it's a when. Those are coming, right? Half of our public health budget at the city, it's about 80 million right now is the total budget. Half of that comes from federal grants. So one of the things I'm very concerned about, if we continue to see those federal cuts in that way, that much of that money would again go away and be disastrous for our community. So one of the things I've asked the staff to do is help us put together a tabletop. At the Pentagon, we call it a war game, right? But a tabletop really helps you, hey, what is that question that keeps you up at night? And let's answer it. Let's try to reduce as much uncertainty in our decision-making process. So that helps us better engage with the county. That helps us also better engage with our partners in the community that can help us solve these problems. Because as you know, just because the money goes away doesn't mean the problem goes away. So how are we going to be thoughtful?
Is there an issue that does keep you up at night, like an overwhelming issue?
Public health in particular. I mean, there's public health because not only is it decreasing, are the funds decreasing for that? Again, the cuts that we're going to see, disastrous cuts. The federal Trump's, frankly, reconciliation bill, cuts to Medicare, Medicaid, Social Security, SNAP, CHIP, Children's Health Insurance Program, all the most vulnerable folks are going to experience those cuts. At the same time, we're going to have to make changes in our own budget based on flat property tax, flat sales tax, et cetera. On top of, especially in the public health space, you're seeing continued, frankly, misinformation, disinformation. So not only is it less money, less resources to address the problem, but the problem is getting more challenging, right?
We just had Metro Health on yesterday
Dr.
for our noon show, and they were concerned of that because they said 90 positions may be wiped out because of the federal cuts that is coming our way.
Well, and that's the real concern. I mean, public health, as we saw during COVID, that is the area where we are the least resilient, right? And that's where the challenges can spiral out of control very, very quickly. And that's why I want to make sure we're at least trying to reduce the uncertainty in our own process to be able to identify where can we fund those. perfect example actually from where we just started. We talked about one of the things that we have analysis on is a staffing report, right, on police officers. And I think we're going to revisit that based on, challenging some of the assumptions in that. I think what is also important though is that we have as rigorous analysis in our public health staffing, in our mental health staffing, in our parks and rec staffing, all the other things that really also help us contribute to a strong community. Our analysis in those areas should be just as good so we can fund them just as well.
Are you able to track the money that is allocated for different things to figure out if it's actually being used properly?
Ding, 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 ding. This was my biggest challenge during the budget season, which is it's really hard for us to see ourselves. That came across for me loud and clear. Some of the data we are not collecting at the level of fidelity that I think we need, and so it's real. To your point, especially in a deficit, it's really hard to say, hey, if I had one more dollar, where would I put that? Right? And so one of the areas that we really need to focus on is how do we better understand the impacts, the ROI, return on investments of these decisions. So I look forward to working with our team to better do that this time around.
All right. Well, we appreciate you coming on. Thank you so much.
Mornings with the Mayor every Thursday. Mayor Gina Ortiz Jones, thanks so much. By the way, always love, send us Facebook messages, Instagram, all that good stuff. If you have a question for the Mayor, we would love to see it and then pass it along, and maybe it'll make the air as well.